doesn't have to be a cavity. So we tend to use 2%. We don't need to use 4% for it to be effective. So we're using 2% minocycline. The reason we say Arrestin is it's a little less scary to the patient, right? It is the brand name. So it tends to get accepted more rather than, hey, we're using this. For example, the oral sedation pill we use, the brand name is triazolam, but we all call it Halcyon, right? So it's just verbiage. I'm going to share my screen real quick and let me know if you guys can see it. It's just a very quick chart of different research papers where they say when to use it, timeline-wise, as well as according to your question, Jessica. So the more recent papers are actually telling you to do it equal to 5 millimeters or greater than 5 millimeters. So in my mind, your threshold should be eating as well as 5 millimeters. It should be recommended. Some of the older papers you can see right here, 2001, the lower left one, that is where they're saying 6 to 9 millimeters. So the newer papers are actually suggesting 5 millimeters or greater. So I think our standard of care should be 5 millimeters or greater. And then obviously it works, you know, it helps with bleeding, it helps with clinical attachment loss, it helps with pathogen reduction, as Dan was discussing, and it definitely helps with pocket depths. So I think our first line of defense always has to be SRPs with irrigation, the chlorhexidine rinse. Most of the time that works. And then Shrujal has set up this amazing system where the patient comes 6 weeks after. We need to reprobe, and anything 5 millimeters or greater should be diagnosed with Arrestin. There may be 5 or 6 sites of Arrestin. That's okay. Arrestin works, so we should diagnose what we have to do. And then we can bring them back in again for a second post-op check. Dan, when you do Arrestin, what's your second post-op check timeline?
It's FRPs, and then 6 weeks out, we do the post-op check. After that, we bring them back like a month and a half for SR or paramaintenance. So about another month and a half, pretty much 3 months from the SRP. So they schedule 2 appointments. They do a 6-week re-eval and then a 3-month paramaintenance.
Yeah, that's perfect, because the second paper by Arnett says there's improved production at 6 months, and then the other one says 6 to 12 weeks after Arrestin.
Yeah.
Mm-hmm. Yeah, and then we review those sites again and reprobe and see if it's improved. If not, then the next step is the perio consult.
Yeah, main thing you guys want to emphasize, obviously, too, is the at-home care. You could do all this treatment, but if they're not flossing, brushing well, then you won't see great results. It's at-home care that's crucial to get these results.
Yeah, definitely.
Another question.
Yeah.
So we're probing when they come back at the 6-week mark, and then probing again when they come back for the perio maintenance.
Yes, correct.
You can spot on your Arrestin sites.
Okay, gotcha.
Yeah. So if you place 5 Arrestin sites, just check those 5.
So do you guys want us to probe every 6 months? Like, how often do you guys want us to probe?
You can probe all the time, honestly, but you don't have to always update the chart, but at least spot probe it. And then if there's any, in your notes, you could write if there's an improvement, if it's stable. But yeah, you don't have to update the chart, but you should probe all the time, at least spot probe for sure.
Yeah, and full probing once every 6 months, even if it's a preoccupation, because you never know when clinical there are clinical changes.
Okay, thank you.
Okay, great. So if Liana's there, Liana, can you hear us?
I think she is there. You're muted.
She was there.
Got it.
Okay, great. So Liana's been a hygienist for more than 30 years.
Okay.
And she works out of our Thousand Oaks office. She is a great hygienist, with what she does clinically and as well as in treatment planning, case acceptance, educating patients. She is great in those areas as well. So, as a hygienist, we should be educating patients on pending treatments. We should be talking to patients about, hey, you need a crown on this tooth. It's been pending since last 2 years. Let's go and get it done. It's not going to get any better by just, not doing anything about it. So as a hygienist, we should be having those conversations with the patients and then, do a quick handoff if the patient is interested. If there's any other clinical questions, do a handoff with the doctor and let them know. Okay, but I want Liana to talk about it. So Liana, take it away.
Okay.
Take minutes or 10 minutes.
No. Okay, I see our role as a hygienist as being an educator. And it's really important to patients. Patients will discuss things they're concerned about oftentimes more with the hygienist than they will with the dentist because they're not embarrassed and they feel that there's a rapport there. We don't, as hygienists, we don't stand to gain anything financially. Patients still feel that way. When the dentist diagnoses stuff, sometimes it's threatening. So I'll take my x-rays or after years of a rapport with the patient, I'll create a need. People don't do things unless there's a need for it. And so like, as I have a lot of retired people getting older, I discussed with them the importance of good dentistry and a healthy mouth for their nutritional state so that they don't end up with geriatric malnutrition. So you're creating a need. Why at 80 they still need to do a crown on a molar? Well, if they don't have a molar to chew with, that's going to affect their general health as well. But most importantly, I try and take the mystery out of anything in dentistry. I refer to dentistry as not being rocket science. Everything makes perfect sense if you understand it. And I try and keep it, pretty simple. I show them a model. If they have a filling in a tooth, I show them with the intraoral pictures where there's a fracture or a decay or whatever. And I explain to them that once you remove this with the picture, there's, 60% of the tooth structure is removed or the cusp is removed, and they have to put a cap or a crown over the entire tooth. And you take the mystery out of all of it. And I think that makes a really big difference. If you somewhat prep them for what's going on before the doctor gets there, that helps a lot because it doesn't come, out of left field. And then once the doctor leaves, the doctors are really good oftentimes about doing exams in the middle of treatment. And I find that to be really helpful because you can reinforce then or address any questions they have or any concerns they have or any fears. Fears are a really big thing. And I'm constantly telling them that their fear is real. No one has a right to tell you that your fear is not real. It is real. And so you can overcome fears oftentimes with knowledge. Anyway, so that's kind of what, you gain their trust, you gain their confidence. And if you're there, I've been in this office for a really long time. So I know a lot of these patients really, really well. And they'll say, okay, well, if you say so. And of course, my standard line is I don't have the right initials after my name. But, they trust you. They trust you very much. And oftentimes with the doctors rotating, the steady figure, the stable figure in the office is the hygienist. And that's the way it's been in our office for a long time. And patients really come to appreciate that. That's all.
Yeah, I thank you, and it's really great what you're saying. I think the intraoral cameras are Beth friend. What I do is I put it on that big screen in front of them and let them think about it. So while they can see with their own eyes that there's a fracture, a metal fracture, whatever it is, right? So we're not making things up. So that's one, is finding new things, amalgam fractures, gingival recession, but then also reminding the patient, hey, doctor diagnosed this last year, you were actually going on a trip, so you decided not to do it. Guess what? It hasn't gone away. So we're re-emphasizing what the doctor had diagnosed prior and letting them know that it's still there. So I think that's important as well.
One more thing though, some dentistry is a long sales cycle, so to speak. If someone has, we have a patient in our office right now who I've been talking to for years about these 6 front teeth. She doesn't like the way they look. And so over the years, we've talked about what you can do, what you can do. And then all of a sudden, out of the blue, she comes in and says, you know what, I've kind of been thinking about that. And I think I'm ready to do it now. So sometimes the cycle of acceptance isn't real quick. Yeah, you plant a seed, and you nurture that seed every time you see them.
That's right.
Yeah, that's very true. I also want to say something that Leanne does very well. And then I know Dan does it very well. And I've been working with Jessica. She's great at it as well. There's a connection factor that Leanne is very good at, and Dan is very good at Jessica. You don't always have to talk about dentistry. You can talk about their life. You can talk about other things. And it's enjoyable in that sense too, right? So we're obviously there to take care of their oral cavity and systemic health, but it's also nice to form that personal connection with them. Leanne, on that, there was a patient that I started Invisalign on yesterday, and I don't remember his name. I'll get it to you by the end of the meeting. But he's like, I live in Ventura, and I've been driving to Thousand Oaks solely for Leanne for the last 30 years. So I just wanted to give you some props there.
Thank you.
His name is Craig Beecher.
Oh, Craig, that's wonderful. Oh,
Yeah.
that makes me happy. He's a cool guy.
So yeah, he's great. So I'll be doing his Invisalign, but he still wants to come to Thousand Oaks for his cleaning. So I'm not going to take that away. Don't worry.
Thank you.
Yeah, we should also see their dental history as well. I'm not sure if you guys are looking at the dental history that they fill out. In dental history, they put down their concern as well. Hey, I'm interested in whitening. Hey, I'm interested in straightening my teeth. I'm not happy with the way my teeth looks. So, as you see those new patients, look at those dental history, look at their concerns, and address them as well, or bring it to doctor's attention. If you see a patient with the crowded teeth, don't hesitate to mention, hey, we have an iTero scan. Let's go and scan those teeth if you're interested in straightening them. So, I want you guys to have those kind of conversations when you see those patients.
Do you guys all know how to get to the dental history? I've made it mandatory every year that the patient's going to do it. So if you notice some patients do it and some don't, that's going to change. Everyone's going to be doing dental history.
Yeah, no, I know how to find it. Yeah.
So it's in the imaging tab. It's a pretty short.
Yeah, it's one page.
It's very short, so you can get a lot of info very quickly.
Yeah.
So one of the reasons why we wanted to have this meeting is we wanted to give you all the tools for your success. And some of the things that we have is to take home whitening kits. So I'm going to share my screen with you to let you know the cost of it, and then so you guys are aware and you can offer it to the patients. Okay. So these are some of the costs that we have for example, take-home whitening kit. We have it at $49. We can offer it to the patients. Sonic electric toothbrush, water pick, toothpaste, and all these costs are also available at the front desk. So you can also ask the office manager to provide the cost to you. Arrestin, gingival irrigation, night guard, varnish, fluoride.
Regarding the whitening and the water pick and the electric toothbrush, could we make a nice little sign or something saying, I didn't know we had all that stuff, to be honest with you.
Okay.
Can we make a nice little, tasteful little thing saying, hey, or something, a sign to put up maybe in the hygiene room or something, so that they see that that stuff's available? Because like I said, I didn't even know that. That's pretty.
Yeah, we have a product catalog, should be at the front, somewhere. But we
Okay.
can go and print it out and put it in the hygiene room for you.
Yeah, I think if patients could see that, they might be, because those prices are very reasonable.
Yeah, exactly.
Yeah,
Yeah.
the point of those products is not really to make money, it's just a convenience factor and goodwill for our patients. And I use all these products, they're all very good.
Is the whitening, are we still using Opal Essence or using a different company?
The opalescent for the in office, for the take home, we have the clove whitening kits, the white ones. But
Oh,
it's the
nice.
same active ingredient, it's carbamide peroxide.
Yeah. And that one's kind of like over the counter. They don't need a custom trace.
They don't need custom trays. Have you seen what it comes in? It's like a little,
I think, I'm not sure.
you can open one when you get to the office.
We have an open inquiry issue at the front.
I'll check it
Yeah.
out.
It's like a little bite guard. It doesn't have the
Okay.
actual.
How many come in a pack?
There's 3 syringes. And
Oh, 3 syringes, okay.
each syringe, I mean, I use it. I probably get 6 to
Yeah.
7 uses out of it. It's significant.
And you wear it for like 20 minutes? Like,
Yeah, how often? What's that?
Yeah, you need to wear it for 10 minutes.
10 minutes?
It's pretty
For how
strong.
many days in a row, or once a week, or what's the frequency?
Yeah, you want to wear it for every day for 7 days.
Okay,
Most people will not be able to deal with its sensitivity, so they'll stop after day 4 or 5.
so you tell them just to put a little bit in so it covers the fronts, right? Fronts of the teeth, facial.
Exactly.
Okay.
Have them put it on the buccal wall. If they put it all over the place, it spreads and it can cause irritation.
Okay, cool.
It works really well though.
Yeah, so these are all available. Did everyone know the sealants for Dencal patients, that they're covered for patients who are under 21?
yeah.
So, if not, then yes, it is covered under 21. So if we do see patients who are under 21, we can go ahead and do the sealants on them. Of course, we'll have.
Yeah, you can do sealants on under 21 on virgin teeth. So if there's a composite or an amalgam on the tooth,
Yeah.
you're not on the sealant on it. Even if it's on a different groove. That's just how the insurance works. That being said, even if the insurance doesn't cover it, we should still be talking about sealants. Sealants are great. You guys all know that.
Yeah, for sure. The in-office whitening is still $525, as we said, and it's opalescence. And just wanted to touch base with you for hygiene bonuses, right? So we have hygiene bonuses for if you guys do arrested for site, whitening, irrigation, and laser. So keep that in mind as well.
So for laser, I know not everyone has a laser in their office.
Yeah.
And work on it. You do need to be trained on it though.
You need a certification.
You need to get certified on it, and I want everyone to be comfortable with it as well. So we'll get to laser, but Sheila, our hygienist, and Encino, she's not. I think she was trying to join her. She might be here.
No,
She did a lot of it here. So she actually in the Encino office, we do 6 laser sessions for $1,500, and she probably gets 1 or probably 3 of those a week actually accepted.
Wow.
She gets a very hefty bonus on that. So the opportunity is there, but I've listened to her talk. She talks about the benefits to every single patient. So I kind of wrote up some things on laser and arrest, and I'll make sure that Trigel sends it to everyone. Just the clinical benefits of it, so that you're able to effectively communicate with the patient of why you recommend it.
Yeah, So, that was it. Want to make sure we do a handoff with the doctors in front of patients for, what the patient needs, whether it's pending treatment or, we're diagnosing SRPs, discuss period charting, bleeding on probing.
Perfect, yeah. Also fluoride, a lot of insurances cover fluoride. So if fluoride is on your appointment book, it's there for a reason, so make sure you're placing fluoride.
Does Denical still cover it like for all ages?
Once a year, they cover it for adults, yeah.
Yeah, okay.
So our team in the back is putting it on the appointment book. So if one of your codes is at fluoride, FLO varn, that means it's covered. So that means place the fluoride. And then if it's not there and you still want to place fluoride, then obviously get your front team to discuss the fee with them. It's a minimal fee, so we should be recommending it to almost every patient.
Yes.
So for kids, that fluoride's covered in Denical twice a year, once a year for adults, and then these PPOs also cover it once a year. Some don't after a certain age, but I'd say 60 to 70% of patients have fluoride covered.
Yeah, we should be recommending to most of the patients. And you can get somebody from the front to mention the cost of it.
Yeah. Does anybody have any questions about the flow? Any thoughts of how we can improve, or anything that you'd like to know? Marianne, are you excited to start?
A little nervous, actually. Yeah, I'm excited.
You're going to be working with some good doctors, so that they'll answer all your questions and make sure you're comfortable. And obviously, we have a great team here as well, so you can reach out to me in this call.
Okay.
Awesome. I'm gonna also send a lesson how to use it, because you have the tubes. So I might have Dan make a video for everyone of how to actually use it and then how to administer it. It's very easy once you have a video, once you're shown it once or twice, but the first time is probably the hardest.
Yeah. I like it better than the actual arrest in itself.
100%, yeah. So arrest
hopefully if we have to use it, right? Within certain days before it expires.
Oh yeah.
So Orexin was the brand name. It was a powder that would go into the sulcus, but obviously powder flies out because there's no liquid to hold it in. So we started using the minocycline gel, which you activate just like the whitening, and once it's activated, you have to use it within a week.
What's a week? Yeah.
Yeah.
You have to refrigerate it too, right? Yeah.
You have to refrigerate it. You have to use it within a week, but it's also a gel, so it just stays in there. It really works. Patients can't really wash it out. It doesn't fall out, so it works really well.
Dan, when you make that video, would you also put some information post-op or?
Yeah.
Give that to the patients as well.
Yeah, that's important.
Okay, and I have one constant patient complaint is the amount of text messages they get. I don't know if it's just unique to our office, but they want to know how that can be controlled.
Even then, we have cancellations and no-shows.
Yeah.
Well, I think they.
It's never enough.
You get a lot of text messages because the text says press C to confirm. If they don't press C, then they keep bombarding them.
Yeah.
If they press C, then they're done.
Oh, well, see, I didn't know that. I'll tell them that. Yeah.
And then if they press C, then they only get one message an hour before the appointment saying, okay, see you in an hour.
Oh,
but if they just keep reading them, then they'll keep coming. So let them know.
Yeah.
Okay. You should make a sign for that too. No.
And Shrijal, we can make sure everybody has the product guide too, so everybody knows where that is in the front or in the hygiene room.
We'll go and put it in the hygiene room as well.
Yeah, that sounds great. Thank you, everyone. Really appreciate it. You're the face
you
to,
all.
to a
Thank
lot
you.
of our patients. So,
Thank
know,
you.
yeah, thank you.
Thanks.
Take care, everyone. Have a good night.
All right, good night.
Okay.